Hi, and welcome to Principles of Immunization Part 2. My name is Doc Popo Solier, and I'm going to give you Part 2. Duh. Alright, so this is a relatively shorter part. But I purposely separated this from the other parts because you have to understand these concepts. Okay? Pure memorization will not help. Okay? But you really have to understand because these concepts that I'll introduce in this part are the ones that are commonly asked by the patients. All right? So let's begin. So, in our outline, part 2 is about the general rules of immunization. Let's begin. Number 1, vaccine and organism similarity. So basically, the more similar a vaccine is to the disease-causing form of the organism, the better the immune response. This just means that if you're giving a live vaccine at one dose and you compare it to an inactivated vaccine na one dose then, the live vaccine is going to elicit a better immunologic response because it's closer to the natural infection. Okay, but there are ways in order to achieve good immunologic responses in inactivated vaccines. Okay, and we'll talk about that. Live attenuated vaccines are weakened forms or of the wild virus or bacterium, and they must replicate in order for them to be effective. That's why they're effective. They're still alive. Okay, they're similar to the natural infection, but that's for the immune response. But the disease again is milder or even none. Usually not. They usually produce immunity with one dose, but you still give a lot of boosters afterwards and second doses. Severe reactions are possible, and interference from circulating antibodies can happen, and we'll talk about that in rule number 3 or 4. And they're very fragile. Since they're still alive, they're very sensitive to heat and light. Again, my prom bite VR, which you can buy in DV. Okay? Okay, let's proceed. That's why you have to memorize them, remember? Inactivated vaccines cannot replicate. That's why you have to give around 3 to 5 doses of the inactivated vaccines, and the response may diminish over time. Less interference from circulating antibodies than live vaccines. So if there are circulating antibodies, like for example, the patient just received red blood cells or blood transfusion and there are circulating antibodies there, then you might want to delay if it's a live vaccine. But if it's an inactivated vaccine, you can vaccinate immediately. And we'll talk about that later. Mostly humoral response. And these are the things that we discussed in part 1 basically. So you have viral and bacterial for whole inactivated viruses. For protein and polysaccharide based fractional vaccines, you have the toxoids, the subunits, the pure, and the conjugate. So for pure polysaccharides, like I said, since they're not conjugated, they're just the polysaccharides, they might not elicit the immune response that you're hoping for in children, especially those younger than 2 years old. That's why you give PCV 13 rather than PPSV 23 to pediatric patients. Okay? Especially for babies. Immunogenicity is improved by conjugation, and we talked about that. Number 2, the effect of a circulating antibody. Number 2 pala siya. Okay? Inactivated vaccines are generally not affected by circulating antibodies to the antigen compared to the live attenuated vaccines, which may be affected by circulating antibodies to the antigen. Okay? What does that mean? Again, if there are circulating antibodies, you cannot give your live vaccines immediately because interference might happen. They might bind to each other, rendering your vaccine not effective. Okay? So, this is applicable for measles and varicella containing vaccines. If you give the vaccine first, you wait 2 weeks before giving the antibodies. Okay? Any kind of antibodies. Whether it's specific for varicella or measles or any kind. Okay? But if you give the antibody first or any product with antibodies, you have to wait. Okay? And this one is dose dependent. I have a table for this. Usually it's more than 3 months. Alright? So you wait for the antibodies to wane, to not be effective, so that the vaccines will be effective later on. So as you can see, do not memorize. I already gave a magic number of at least usually more than 3 months. So if you give blood transfusion, it depends on the products. If it's just plasma, you have to wait for 7 months before giving measles or varicella containing vaccines. Okay? If you're giving whole blood, you have to wait for 6 months. Okay? And it depends on the dosage. For hepatitis immunoglobulin, if you're giving Hep A IG, usually 3 months. Okay? For others, mga replacement therapies for immune deficiencies, you have to wait for 8 to 11 months. 8 to 10 to 11 for Kawasaki disease. Okay, for measles, you have to wait for 6 months. So, moral of the story, loko, you have to wait. Okay? If it's a live vaccine containing measles or varicella. Next is the timing of administration. All vaccines can be administered at the same visit. Almost all. So there's an exception. Okay? So the timing of administration. Minimum interval is usually 4 weeks for 2 live injected or intranasal influenza vaccines. Okay? However, according to the PISMID guidelines, 2 live vaccines should always be administered on the same day. If today, you administered 1 live vaccine and you plan to give another one tomorrow, like for example, measles today, tomorrow varicella, usually MMRV naman siya. But in any case, just to cite an example, tomorrow you plan to give varicella because the baby cannot take it anymore or the child cannot take it because of the pain. You have to wait for at least 4 weeks to give the varicella. But if you're going to give them at the same day, it's okay. That's why we have a preparation na MMRV. Okay? This is because you want to minimize the potential risk for interference. Okay? But for all other vaccines, especially the inactivated vaccines or the killed vaccines and mga conjugate vaccines, there's no minimum interval. Alright? So please take note of that. And you can give them all at the same time, the inactivated vaccines, if it's the right time. Okay? There's just a very specific exception in asplenic children who don't have spleens anymore. Pneumococcal and Menactra brand of your meningococcal vaccine should not be administered at the same visit. You separate them by at least 4 weeks. Alright? So this is basically what we discussed. There's a 4-day grace period that does not exist here. Okay? We have a 4-day grace period later. We'll discuss that. Okay, here, there's no grace period. Strictly speaking, if you don't inject 2 live vaccines on the same day, you have to wait for 4 weeks, at least 4 weeks, to prevent interference. Just in case you injected measles today, you injected varicella after a week, you have to repeat the varicella, the second vaccine that you gave. Okay? Exception is yellow fever, which can be given less than 4 weeks after measles vaccine. Alright? Those are common questions. And when can you give the vaccine? Or when do you repeat vaccines? Okay? Alright. Next is the interval between doses. Usually, there are recommended intervals. Like for example, there's 0, 1, 6. That means at day 0, after a month, the second dose is given after a month, and the third dose is given 6 months after the first dose. That's 0, 1, 6. Okay? So, these are rules. Increasing the interval between doses of a multi-dose vaccine does not diminish. So if the recommended schedule for Hep B, let's say, is 016, you forgot to give the third dose at 6 months, then you can still give it. You don't have to restart the whole series. Okay, let's say you forgot it. And then you gave it after a few more months. Like 1 year old na si baby. Then you give it. Okay, you don't have to repeat. However, this is very important. Decreasing the interval between doses of a multi-dose vaccine may interfere with antibody response and protection. Okay? So, if you gave them earlier, you would have to repeat the last dose. But there's a 4-day grace period. Okay, and we'll talk about that later in the next point. So, minimum intervals and ages. Vaccine doses should not be administered at intervals less than the minimum interval or earlier than the minimum age. Like, for example, the minimum age, let's say for Hep A is 1 year old. This is just an example. If you give it at 5 months, you would still have to repeat it. Okay? However, according to the AICP, if you gave it 4 days before the minimum interval, like let's say 4 days before the baby turns 1 years old, 1 year old, 1 years old, 1 year old, then that's already valid. Okay? But if it's 5 days before the birth date of that baby, then that's not valid. You need to repeat that vaccine. Immunization programs and or school entry requirements may not accept all doses given earlier than minimum age or interval. So if you're a school doctor later on and you look at the records and some vaccines were given earlier and away from the 4-day grace period, then you have to restart the series or you'd have to repeat certain vaccines. Extended interval between doses. Not all permutations have been studied, okay? So available studies right now of extended intervals have shown no significant difference in the final titer. So it is not necessary to restart the series or add doses if you forgot a particular vaccine, let's say. You can still give the third dose or the second dose. All right? That's it. Thank you.